Do you have foamy or bubbly urine? And today I'm giving you the top 5 causes you should know. Tell me, when you make urine, do you ever notice that it has a few bubbles? Or maybe a lot of bubbles? Is it outright soapy or sudsy? Or do you have straight up thick foam in your urine? Well, before you just flush it and forget it, you should know that for many people, foamy or bubbly urine is actually a warning sign of kidney disease. It's true. I'm a board-certified kidney doctor, and I can tell you firsthand that for many of my patients, their first warning sign that they had kidney disease was that they had bubbles in their urine. Over 35 million Americans have kidney disease, and most don't even know it. So don't you think it's important for you to know all of the warning signs and symptoms of kidney disease that you can? Well, of course, I think so. And so if you're someone who is listening to me and you have foamy or bubbly urine, keep listening, because today I'm giving you some evidence-based information on the top 5 causes. Keep watching. Here are 5 causes of bubbly urine. Oh, make sure you stick around for cause number 5, because it might surprise you, and it can be so easy to jump to conclusions. Number 1, proteinuria and kidney disease. When you have protein in the urine, it's called proteinuria. And guess what? It's not normal to have proteinuria. It's actually normal to have 0 or very low amounts of protein in the urine. And if you actually have proteinuria, then that is a warning sign that something is not right with the kidneys, okay? And that you could have kidney disease. So here's the deal when it comes to the kidneys. You have these different kidney functioning units, or glomeruli. You're born with about 1 million in each of your kidneys, and the glomeruli have a negative charge. Okay, so let's take it back to science class. Remember, negative repels negative. So if you have 2 things that have negative charge, they repel each other. And your kidney cells have a negative charge, and guess what? So does protein, specifically albumin, a type of protein. So typically, if you have the proper charge in your kidneys, a negative charge, then as your blood is filtered by your kidneys, that negatively charged albumin is going to be repelled, and it's not going to get through the kidney barrier. Well, if you're actually leaking albumin or protein in your urine, then we know that something is wrong with the charge of your kidney cells, which lets us know that this proteinuria is a hint that you have kidney disease. Also, just the structure of the kidney cells, the structure of the glomeruli, they are laced in such a way that it prevents you from leaking protein. So again, if you're leaking protein, it can also mean that something is structurally wrong with your kidneys, okay? So once you have all this protein in the urine, it can cause bubbles, and it can even cause foam. And I'm talking like a thick white foam, kind of like in beer commercials. You know, you'll see them pour the beer, and you have all this, the beer on the bottom and all this white foam on top. Yeah, if you have a lot of protein in your urine, it can cause a foamy urine, and this is an issue. There are many kidney diseases that can result in protein in the urine and subsequently bubbly or foamy urine, such as diabetic nephropathy, FSG or focal segmental glomerulosclerosis. You can also have a lupus nephritis, IgA nephropathy. The list goes on and on. The important thing to remember is that if you have bubbly urine, it could mean that you have protein in the urine, which could mean kidney disease. And if you have a lot of protein in your urine, you could have nephrotic syndrome. Make sure you check out my video on nephritic versus nephrotic syndrome after you finish watching this video. So here's what to do if you suspect that you have proteinuria as the cause of your bubbly urine. Check your body out for different symptoms, like do you also have swelling in your feet and ankles, in your face? Are you noticing that you have some other signs or symptoms of kidney disease? And either way, if you have this bubbly urine, you want to make sure you consult with your doctor right away and ask them specifically to test your urine for protein, and to also just give you a full history and physical to see what else is going on. Number 2, complications from diabetes. Yes, would you believe that diabetes is actually the #1 cause of huge amounts of protein in the urine, or nephrotic syndrome? And I can tell you firsthand that diabetes is the #1 cause of kidney failure. So you can imagine that I have lots of stories of people who have come to me with bubbly urine, and I've been the one to actually diagnose their diabetes. So here's the deal. When you have high amounts of sugar in your blood, or hyperglycemia, this high blood sugar is actually toxic to your kidney filters, okay? It's toxic to your kidneys. And so when this high blood sugar causes damage to your kidney filters, then you no longer have that proper blockage that keeps the protein or the albumin from leaking into your urine. And so diabetes or high blood sugar can lead to kidney filter damage, which can lead to protein in the urine. And again, this protein can lead to bubbly or foamy urine. So here's what you do. First of all, you want to make sure that you keep your blood sugar under control. Make sure that you see your primary care physician regularly. Ask them to check your blood sugar, which is a test that's typically done just in a BMP, basic metabolic panel, your routine blood work. Also, ask your doctor to check for a urinalysis to see if you have any protein in your urine. And very importantly, ask your physician what your hemoglobin A1C is. You want to know if you have pre-diabetes, or if you're totally normal, or if you actually have diabetes. And this is just routine, whether you have bubbles in your urine or not. If you have bubbles in your urine or foamy urine, and you know that you have diabetes, then you want to check your blood sugar right away. And again, go to your doctor, ask for a blood sugar test, ask for your hemoglobin A1C. If you don't have diabetes and you have bubbles in your urine or foamy urine, then still you want to go to your doctor and make sure that you don't have diabetes or pre-diabetes. So again, ask for those tests. Still make sure that you get a comprehensive history and physical, because bubbles and foam in the urine is not normal. Question: on a scale from 1 to 5, 5 being the most confident, how confident do you feel about telling the difference between harmless bubbles versus warning sign foam? Please comment down below. Number 3, urinary tract infections or UTIs. Yeah, this is a little known fact that having a UTI can actually lead to bubbly or foamy urine. This is how. When you have infected urine with bacteria, then the bacteria and the white blood cells and the mucus can sometimes cause you to have bubbly urine. It's true. And even if you have a bacterial infection or UTI and your doctor does a dipstick, then sometimes it can show up as being positive for protein. And so this is an important detail to know, because we know that if you have recurrent UTIs, especially if they ascend or go up from your bladder, through your ureters or the tubes that connect your bladder to your kidneys and up to your kidneys, if you get kidney infection recurrently or pyelonephritis, then over time that can lead to CKD, chronic kidney disease. And so if you're having bubbles in the urine and you suspect that you're having urinary tract infections, it's important to nip it in the bud so that it doesn't lead to kidney disease. So how do you nip it in the bud? Well, number 1, you pay attention to your body. In addition to the bubbly urine, is the urine cloudy? Does it have a foul odor? Are you having pelvic pain? Do you have dysuria, meaning pain when you urinate? Are you having fever, fatigue? Are you getting little spots of blood in your urine? All of these can be warning signs and symptoms of a urinary tract infection. So if you have these signs and symptoms combined with bubbly urine, then certainly you want to go to your doctor to get a urine culture to see if you have a urinary tract infection. The good news is that urinary tract infections, UTIs, are quite treatable. If they're caused by bacteria, then you can get treated with antibiotics. The key is not to ignore the symptoms. Please don't tough it out. If you see bubbles in your urine and you suspect that you might have a UTI, call your doctor immediately and get treated.